can pharmacists best contribute to patient care in an ambulatory setting without having provider status?
That's a great question, and certainly provider status is extremely important and a very important legislative issue that's facing us right now, and I do hope that it will pass, and I'll go on record saying that I'm supportive of it, and I think it's something that we do need. But despite that, in our own practice in North Carolina, we have 6 pharmacists and 4 pharmacy residents who are providing ambulatory care services in a primary care center that's recognized as a patient-centered medical home without provider status. And so I think there's a lot of things that we can do in the absence of provider status. And so some of the work that we're doing, we do annual wellness visits, we do transitions of care work, we do general pharmacotherapy in terms of disease management for things like chronic pain, osteoporosis, anticoagulation, diabetes management. And we work in patient care teams, where we're an extension of the physician working with PAs and nurse practitioners and behavioralists and dietitians and all of our support personnel as well. So certainly pharmacists are making that work in the absence of provider status. I think the thing that would change with provider status would be increased access to those types of services. Because at the end of the day, you have to figure out how to create a financially sustainable model for pharmacists to be embedded into physician practices or to contract with physician offices to go in a couple of times a month, however you want the model to work. They have to be able to pay for that. And so, to date, the profession has really relied on relationships with schools of pharmacy, relied on grants and other things that might not be sustainable to help us pay our way. And so if we had provider status and we were able to be reimbursed by insurance companies like PAs and nurse practitioners are, that would go a long way to expanding the model of embedding pharmacists into patient care. But there's still a lot of things that we can do in the absence of provider status.